So today I'll be talking on the topic of osteoporosis, the basic understandings of what osteoporosis is about, what we usually do to help overcome osteoporosis, and various strategies for you to do so. So let me briefly introduce myself. My name is Ke Wynn, but most of my clients call me Wynn. And I'm actually a specialist in sports injury, corrective exercise, and medical exercise. So apart from osteoporosis, some of the people I see include people with diabetes, NCDs, cancer, Parkinson's, and so forth. And I'm also a clinical massage therapist, and I'm also recognized as one of the most prominent healthcare professionals here in my country, in my state of Penang. And on top of that, I also won numerous awards in my related field. I'm currently practicing in my own private center, named after myself, which is Ke Wynn Medical Fitness Center here in Penang for over 10 years already. So enough about myself. I'm going to move on straight to the topic. So I think osteoporosis is probably a very common condition that everyone above 50 would probably know about. But today I'm not going to delve into the details or the biology of osteoporosis, but rather talk briefly about it and give you strategies on how you can actually overcome them. So what is osteoporosis? It's basically a degeneration of the bone where the bones become thin, brittle, and weak. Now, these changes can increase risk of fractures, especially when we fall. The risk of osteoporosis can actually increase due to several lifestyle factors such as smoking, high alcohol consumption or high caffeine consumption, poor diet, and most importantly, the lack of exercise. And osteoporosis tends to occur up to 5 times more in female compared to male. This is why osteoporosis is often advocated to females. And it peaks during menopause. All right, so when it comes to osteoporosis or the bone remodeling process, there's quite complex stages. But just to summarize things and to keep things easy, we mainly need to know 2 main stages, which are the osteoclast and the osteoblast. So bone is a living tissue that constantly being broken down and replaced. Now, osteoporosis occurs when the new creation of the new bone doesn't keep up with the old bone being lost. So basically, this special bone cell called osteoclast breaks down bone. So what it does that it breaks down bone, and then after that, osteoblasts will coordinate and form new bone. And it usually occurs quite well. It does its job pretty well throughout your life until you hit a certain stage. Right? So when you're young, especially, your body creates a lot of bone tissue. In your mid-20s, your bone mass is likely at its maximal level. And after that, you start to lose bone mass slowly as your body dissolves more bone than it builds. So osteoporosis typically occur when this process starts getting interrupted. So that's why we have too much osteoclast and not enough osteoblasts. And this is when our bone starts to get brittle. So that's just a very, very quick explanation on how our bone remodel. And if you want to find out more, you can actually do more research and understand its little tiny more sub-stages in every part of the process. Okay? So most of the time, osteoporosis presents itself without any symptoms until it's too late. And some of the symptoms that are noticeable for osteoporosis are like a very stooped posture, and you frequently get fractured. And also one of the symptoms is a loss of height. So that's why when we see any advertisement that targets or helps osteoporosis, they often show a lady who is stooping, because those are one of the typical symptoms of osteoporosis. And these are actually, there's a few ways that we can actually minimize the risk of osteoporosis, but there are certain risk factors that certain individuals may tend to have compared to other people, such as like gender. Number one, we've already mentioned that female are more likely to develop osteoporosis than are men. And number two, Caucasian and Asian tend to be at a higher risk of getting osteoporosis. I think something to do with their skin color. So the melanomin levels does influence the amount of vitamin D we absorb from the sun. And of course, number 3, age. As you age older, your risk of osteoporosis increases, and you are at the highest risk when you're above 50. And also, of course, your genetic risk, if your parents or sibling has osteoporosis at a very young age, at the age of 30 and 40, that puts you at a greater risk of getting osteoporosis if your parents were diagnosed with one. And of course, the next one, the most interesting thing I noticed is that people who are with very, very low BMI levels are also at higher risk of getting osteoporosis. So female who are very, very frail or very, very skinny, they are at higher risk of developing osteoporosis when they age. That's likely because the body has less muscles or less nutrient to draw for their bones development. And of course, hormone levels, which is very important, can severely affect our bone. For example, when females hit menopause, there's a fall in the estrogen levels, and then that would actually elevate the risk of developing osteoporosis. As for men, certain treatment for prostate cancer that reduces your testosterone level, or treatments that helps overcome breast cancer that reduces estrogen levels, can also accelerate bone loss. So sometimes it's not because of our own fault, but because of the therapy or medication that we receive can actually directly influence the degeneration of our bone. And one more thing that I've personally experienced myself is I have this hyperthyroid. So what it does means I have too much thyroid hormones, and that can actually cause bone loss. Because even though for me I'm about age of 40, I am quite physically active. I am not frail. I do lots of weightlifting. I do lots of running. And yet when I took my recent bone density scan, my bone density was actually accelerating downwards. It was getting more brittle. Considering that I'm a male, I'm active. I have quite a large amount of muscle mass, but because of my hyperthyroid condition, my bone is actually decelerating. So hormone levels and is very, very important factor that can actually influence our bone density. And last but not least, also because if you have gone through any medication like corticosteroids, it can actually affect your bone density. So if you're long-term under medication for corticosteroids in the long term, it will affect your bone density, and you should actually take action immediately before it's too late. Other surgery like bariatric surgery, where you remove partial stomach or the intestine, that could actually affect the amount of nutrient your body is able to absorb, and that too will actually affect your bone density. So apart from all these risk factors, actually some bad lifestyle also, as I mentioned earlier, can increase your risk of osteoporosis. Among them is they spend a lot of time sitting or being sedentary. They are at high risk of osteoporosis. And it's also people with low calcium intake or those who don't spend enough time under the sun. They are also at risk of having their bone diminish much faster than the average person and increase the risk of fracture. And also some people who are on a very, very strict diet, extremely strict diet, they too at a higher risk because they reduce the amount of intake in their food. And also another major factors that can affect osteoporosis is the excessive consumption of alcohol, which is probably more than 2 glasses a day, would increase your risk of having osteoporosis. And also tobacco use has been shown to weaken bones. So that's the risk factors of osteoporosis. So these are the areas that we want to know so that we know how to overcome them. So how do we know if someone has osteoporosis? There are many ways people, different countries, different professionals diagnose osteoporosis, but it mainly falls into these 3 categories worldwide. So number 1 is the DEXA. Now, DEXA is basically called the dual energy X-ray, where what they do is that they get that person to lie down on this special bed, and that's an X-ray that goes around the body to certain sites of the bone, and they will capture the bone density. And it's actually a gold standard that most countries in the world use to diagnose or to identify osteoporosis. So from the DEXA, we basically get a T-score. So that T-score actually determines how, compared to your bone to a typical 30-year-old female. So what how do we categorize osteoporosis? Is that if your T-score is a -1 to a -2.5, that would put you on the category of osteopenia. So what that means that you are not yet exactly diagnosed as osteoporosis, but you're halfway there. You're in a process. That's why it's called a osteopenia. Right? But if you get a T-score of -2.5 or even lower, then you are diagnosed as having osteoporosis. So this DEXA is pretty much the gold standard that most hospitals and clinicians will probably use to determine if you are having osteoporosis or not. Now, the next one is a CT scan, also known as a computerized tomography. It's actually a higher level of X-ray, and it takes a series of images from different angles. So this often costs more and is mostly used for other medical condition or more severe situation. And it's very expensive, and it's usually used to detect or to measure tumors or cancer or growth within the body. So some people still do use a CT scan for diagnosing osteoporosis, but due to its cost and its accessibility, is usually not used compared to DEXA. Now, the last one, which I find most interesting, is actually an ultrasound. It's not the ultrasound you use where you are trying to see your fetus growth or whatsoever, but it's a very specialized portable device to actually measure bone density on specific site. When you do a DEXA, they usually take 3 sites, which is your wrist, your hip bone, and your lumbar spine. Whereas ultrasound, you can actually measure anywhere, your wrist, your forearm or your femur. So it's actually a specialized ultrasound device that measures how sound waves move through your bone. And based on a signal being bounced back and their calculation, they can probably estimate how dense your bones are. And it's usually used in a clinic, and it's because it's very portable. And sometimes you can measure more often using an ultrasound compared to a DEXA or CT scan. So these are the 3 common areas, 3 common devices or tools that most clinicians will probably use to diagnose osteoporosis. So now we know what osteoporosis is and how do we identify osteoporosis. We need to manage osteoporosis. Now, the goal here is to actually slow down the degeneration, not exactly to reverse, though in some situation, I do personally see a reversal of bone density, but we want to keep in mind that we want to slow things down rather than trying so hard to reverse things, because it's a process, a degeneration process. So the goal is much more relevant and realistic. And the second thing about managing osteoporosis is to maximize that person's function and movement so that they're able to be physically active without hurting themselves. And as always, it's always best to intervene early. It doesn't mean that you only start to take or pay attention to your bone health when you're above 40. In fact, you should start as early as you can in your 20s and be consistent in being physically active, weight-bearing exercises, and so forth. Okay, so number 1, there are mainly 4 areas that you can manage osteoporosis, which are nutrition and supplementation, obviously physical activity and exercise, and hormone therapy, and lastly, medication. So these are the 4 areas that you can actually use to manage osteoporosis. So eating for healthy bones. There is no special diet for osteoporosis, rather the principle or the concept between eating right for healthy bones. Like building muscles for bodybuilders, we want to have lots and lots of protein so that your muscles are able to repair and rebuild. But when it comes to bone, similar concept, but we focus more on vitamin D and calcium. So what we want is to include a wide variety of food, especially leafy greens, nuts, legumes, healthy protein also, because we need the muscles to support the bone and our joints. Obviously, you want to eat less processed food. Again, minimize your consumption of alcohol, and if possible, avoid smoking altogether. So you want to emphasize food that are high and rich, concentrated in calcium and vitamin D. Most of the sources comes from egg yolk, cold water fish such as codfish, salmon, tuna, dairy such as milk, cheese, and so forth. So these are the types of food that are highly concentrated with calcium and vitamin D. And for those who find it difficult to access such food, you can also supplement them with vitamin D and calcium supplements. But what most people would recommend generally, safely, is at least 1,000 IU of vitamin D and 1,000 milligram of calcium a day. Now, some doctors may prescribe higher dosage, up to 2,000 IU of vitamin D. But there are some studies recently that say that excessive consumption of vitamin D can actually cause more problem. And if, for example, your blood levels has already elevated levels of vitamin D and calcium, over supplementing it can actually backfire and cause faster rate of bone degeneration. So it's important that you actually get it checked with a doctor or a healthcare professional before you start self-supplementing food and supplements. But generally, for the general population, even though if you have slightly elevated levels of vitamin D, 1,000 IU and 1,000 milligram of calcium a day is pretty safe. And of course, the next source of vitamin D is sunlight, which is something some people in Asia, especially in my countries, especially the ladies, they tend to avoid the sun. Whenever there's sun, they'll open up their umbrella or they'll cover themselves from head to toe with clothes or some sort, wearing a cap, wearing long sleeve, with a coat and putting up lately sunglasses and a mask, hopefully just to avoid the sun and not get darker. Unfortunately, these are the type of people who have higher risk of bone density. So we want to get sun at least 15 minutes a day. And we don't want the sun when it's at its peak, which is about 12 p.m. to 3 p.m. So some say the sun that's before 10 a.m. is best and after 5 p.m. is best. Of course, in Malaysia, our time, we always get the exact time of sunrise and sunset. So it's easy for us. But for other countries with different, let's say, seasons like winter and summer, you might want to adjust it according to your own country. Okay, so exercising, okay, for healthy bones. So the type of exercise is actually very, very important, right? So different exercise actually promotes better bone growth compared to others. The type of exercise that we want to focus on specifically for bone building exercises are weight-bearing and impact-based exercise. Weight-bearing, I think most of you probably know, exercises such as strength training, or also known as resistance training, where we lift weights or lift an external load, and impact-based activities such as jogging, hiking, and skipping. So these are the type of two exercises that would give you our best bang for a buck when it comes to bone health. And interesting enough, how often should we do this? I've just recently read a study where they did this observation study where they recruited a group of ladies where one group would skip on one leg every day, once a week, and then they don't skip on the left. What it means that they were instructed to keep skipping on their right foot every day and not on the left, so that they have something to compare with. And one group did 1 to 2 times a week, the other group 3 to 4 times a week, and the other one did more, or almost every day, 5 to 7 days a week. And at the end of the study, they found that the group that did only once or twice a week showed very little improvement, whereas those with high frequency, which is about 5 to 7 days a week, showed quite a big difference in their bone density compared to the right and left. So what this actually tells us is that frequency matters when it comes to building healthy bones. So if you can, one should actually perform weight-bearing or impact-based exercise at least 3 to 5 times a week to get the results that we want. All right, so frequency also matters besides the type of exercise. Now, the next thing is called hormone therapy. So some of the doctors may recommend hormone therapy to balance your estrogen and testosterone to reach its optimal state. And there are different types of medicine to slow down, but it is often with side effect. Now, the thing about hormone therapy is not a subject that I am very good at. So it's best that you talk to a doctor in this area. But it's good for us as a healthcare professional to know what sort of therapies are out there for osteoporosis. And one of the common ones are hormone therapy. And of course, medication. So if all fails, or you are point that your osteoporosis is so severe that you need medication to intervene to help build bones, there are certain medication out there which will be recommended by a doctor. Examples are bisophonates, denosumab, and all sorts. So it's important that you talk to your doctor and stay within your scope of practice, especially if you are not familiar in this area. But I just want to highlight some of the downfalls of taking medication for osteoporosis would include side effects such as nausea, abdominal pain, heartburn, and in some rare situation, they have a fracture at the middle thigh of the middle thigh bone. So they are at higher risk of fracture of the middle thigh bone. And also if there's a fracture of the jaw, it takes a very, very long time to heal. So these are some of the common side effects of taking medication. But often enough, your doctor will probably know the benefits would outweigh its risk. So if you are given a medication for your bone, you should discuss with your healthcare professionals. And then, of course, the doctor knows what is best for you. If you're okay, just go through the medical regime. And of course, intervene with other lifestyle changes that you can do, such as diet and also exercise. All right, so why I always emphasize exercise? Because I'm an exercise professional, and it is one of the key areas for us to overcome bone density loss. But before that, we need to understand Wolff's Law. So Wolff's Law is basically, he's a German surgeon called Julius Wolff in the 19th century. And his law actually states that our bone, all muscles, all body, right, will adapt based on the stress or demand placed on them. And they will adapt over time. And this process is also called bone remodeling. So basically what it says that our body needs stress to get better, and then our body will adapt and improve, right? So the word is, it needs stress and the body will adapt. So this is the basic understanding of Wolff's Law. Bone physiology is, again, I'm going to make it very basic. So when a mechanical force is applied to a bone, which is, again, critical for bone health, it mainly comes from two sources. Number one is the external gravitational loading force. And interesting enough, the internal loading force from muscle contraction. So external gravitational loading force is like lifting weights, and the internal is actually the contraction, the process of lifting the weights. So this is why sometimes we want to increase muscle mass. That's why when I mentioned earlier, if your BMI is very low or you have sarcopenia, which means loss of muscle mass, it can also increase your risk of developing osteoporosis. So this is why when we want to increase our muscle mass, because muscle mass can induce higher blood flow and improve supply and nutrient to the bone. And of course, muscle can also stimulate osteogenesis by secreting local growth factor hormones. So sometimes we don't know if our load is enough for our bone. One way that I would personally do is to measure muscle mass and make sure that we are trying to improve more muscle mass in our exercise program. So that's bone physiology. Now, impact-based activities. Now, I got this diagram from a physio lab. So not all activities are built the same. So we have these two categories, the non-osteogenic categories and the osteogenic category. The one at the bottom contributes less to our bone building process and is often less impact-based. So if you look from the bottom one, the poor choices for improving bone health are like swimming and cycling. This is because that there's no impact when it comes to swimming. It's usually used for people with severe osteoarthritis. And road cycling, basically there's no impact on your body. Your legs are just spinning the bike. And of course, as we move up, walking doesn't give much benefits to our bone, but it does help us, try to slow things down, but it doesn't really build the bones up. So walking is good, but it is not enough. Then as we go up higher level, you see fast walking or brisk walking. Then we'll see downhill mountain biking. Why downhill mountain biking has a little bit more osteogenic benefit is because when we go down, there's lots of vibration. So that helps with our bone. Then it goes on treadmill running. And then as we move up, will notice that sprinting, lots of power, lots of heavy hitting on the ground, it gives us more osteogenic benefit. And of course, as we go up, this is where the type of exercises that or activity-based, impact activity-based, we should focus on to improve our bone health, which is resistance training, hopping, jumping rope, box depth jump, basically like plyometrics, box jump with vest, zigzag hopping. So what can we take away from this diagram? It's actually the impact. So the impact actually does make the difference for our bone health. So activities with less impact, less benefit. As we move up the chart, activities with more impact, the better it is for our bones. All right, so if you want to prescribe physical impact-based activities for your clients, then you might want to gradually build them up towards the top. All right, so now when it comes to exercise programming, number one, we always want to emphasize for someone who is osteopenia or osteoporosis is fall prevention. Why? Because the bone is at its highest risk when we fall, all right? So this is something that we want to avoid entirely if possible. So the first thing that I would do for my clients before I do anything else is to introduce fall prevention drills so that they don't fall. Now, of course, we can't avoid falling, but we can minimize the risk of falling. So how do we do that? Is basically introducing two types of balance drills, and they are mainly static and dynamic. So static basically means not moving. You're standing on one foot, for example, for a couple of seconds, depending on what time frame you set for them. It could be 30 seconds to a minute. And of course, the next one will be dynamic. Dynamic simply means that there's movement involved, like standing on one leg and swinging your arms or moving from left to right on a single leg. So that is dynamic. So we want to include both because we want our programming to be progressive. So for someone who is at higher risk of falling, you might want to introduce static, where you get them to probably start from standing on a bipedal stance, which means with both feet next to each other, then move on to staggered stance, which is probably one foot in front of the other. That's one way of progressing. And then next one's a tandem, where literally one foot in front of the other, front and back, where their base becomes even more narrow. And if they are able to manage that, we'll probably do a single leg stance for 30 seconds to a minute. And then we'll probably move on by doing a single leg stance on an uneven surface, like a yoga block or foam, for example. That would create more dynamic into it. And once they're able to master that, then I'll probably introduce dynamic balance, which is more functional, where they have to stand on one leg and swing their arms or maybe rotate their torso left and right, because that would actually mimic the real world. So fall prevention is number one when we do exercise programming. And the next thing we want to do is posture correction. As I mentioned much earlier, one of the signs of osteoporosis is a very stoop posture. So when our posture is rounded, it actually places more stress on our neck and our lower back. And that areas increases your risk of having some bone fracture if we fall or something happens to us. So posture correction is actually very important, as much as we can, to get back them into alignment so that their body is able to support the entire structure. The whole kinetic chain is moving efficiently. There's no stress on certain joints or certain part of the bone. So posture correction is the next thing that we want to do. And to do that, we need to perform assessment and movement screening so that we can actually identify which muscles are actually tight or which joint is restricted. And of course, what are their weaknesses or muscle imbalances so that we're able to address them. And then we can move on to strength training safely. Because with good posture and good movement and mobility, you're able to introduce strength training, which will place more stress on your body safely. So if we don't address posture correction and we load them immediately, we are actually risking placing more pressure at their weak links. So don't just load them immediately. We just want to make sure that they are moving correctly, their posture is at least acceptable before we start loading them with weights and then resistance training program. Okay, so when it comes to exercise, There are hundreds of different types of exercises. You probably see them on YouTube, TikTok, or Instagram. But when it comes to bone health, we need to identify closed chain and open chain type of exercises, right? So what is actually open chain? So open chain basically means that the distal end of the extremity is moving freely in space. So what it means that the upper kinetic chain, where it consists of your fingers, wrist, arms, shoulder blades, and your upper spine. That's your upper kinetic chain. The lower kinetic chain includes your toes, feet, ankle, knees, leg, hip, pelvis, and lower spine. So this upper and lower chain it can move independently, and it's capable of different movements. So it depends if the upper chain and the lower chain is fixed or free to move without restriction. So that's why we have this open chain and closed chain. Take, for example, if you do a knee extension, so your extremity is your ankle, and then after that, it's moving freely, all right? So your hip is not in contact with the ground. So that's why the chain is open compared to a squat where your feet is actually touching the ground and your hip is moving. So that's a closed chain. So when you do an open chain, you are actually putting a lot of forces, a sheer amount of forces at your joint when you compare it to closed movement. For example, when you talk about the knee extension, the force is concentrated at your knee. Okay, so and it's often categorized as an isolation movement. So when you do a knee extension, you're actually isolating the quadriceps. And we usually use lighter weights because of the sheer force, your risk of hurting that kneecap is elevated. So we don't go heavy when we do a knee extension, we actually go lighter. This is why open chain is often used for rehabilitation purposes. If you just had a knee rehab, for example, or meniscus repair whatsoever, a very, very light knee extension is often prescribed to help you activate and strengthen the quad so that it's able to support the knee. And this is why it actually strengthens the muscle more than the bone, okay? Now, compared to closed chain, the extremities are contact in the ground or with another solid object. For the example is that squat, like what you're seeing on the image on your right. And the great thing about closed chain is that it has the potential to recruit more muscles and their joints. And it's often referred to as compound movement. Basically, you're using different joints, more than one joint, and more than one group of muscles. So they're called as compound movement. And it's way more functional and can lead to overall healthier joint and also structure. So when we do the squat, you're actually utilizing the quads, using the glutes, using your core, and depending if you're holding a weight on your arms, you're also using your upper body, your shoulders, and all. So one movement engages the whole kinetic chain. So this is why when it comes to bone density, we will often choose a closed chain type of exercises compared to open chain. Now, I'm not saying that open chain is irrelevant. It depends on your client's situation. Say, for example, if a client injured the knee and that person's quadricep is very weak, if you introduce a closed chain exercise, that person may compensate because the right knee, which is the injured knee, is weaker than the left. And if you keep going on using closed chain, which is a squat, they may compensate without knowing. And instead of using it right and left, they may tend to favor their left more than their right. So in that situation, the open chain exercise has its relevance. So you may want to use knee extension to at least fire up the right quadriceps, strengthen it to a point that is almost even to the left, and introduce closed chain. So it's not as straightforward saying that only for osteoporosis, closed chain only. But we want to utilize both, but the main focus, if we can, for maximal bone health is to choose closed chain exercises. So other examples of open chain exercise are like bicep curls, isolation type of exercise, tricep kickbacks, those are isolation type of exercises. Closed chains are like squats, deadlifts, lunges, push-ups. Those are type of exercises that are categorized as closed chain. Okay? So now FIT protocol is how we design an exercise program. So FIT basically means frequency, F for frequency, I for intensity, T is for time, and T is for type. Now, this recommendation is based on the American College of Sports Medicine, ACSM, where they would recommend to do at least 2 resistance training a week. And is for someone who is new, you might want to plan a day of rest between a strength session. So basically, if you do it on Monday, you want to rest on Tuesday, simply because our muscles need a day to repair and to recover. The intensity that's suggested by ACSM would be moderate to vigorous, about 10 to 15 reps per set. And time, as in 2 to 3 sets of repetition for all major muscle group. And the type that you want to do for osteoporosis are balance exercise and strength training. And also to incorporate 5 major movements when you do strength training, which is, I would put it as a pull movement, pull. So you have lat row or lat pull down as a pull movement. And then you want to have push movements such as push up or chest press. You have the squat and hinge movements such as deadlifts and squats. You have the lunge movements such as step up and lunges, and rotational movements such as torso rotation cable, thoracic rotation, and medicine ball, and so forth. So when you design strength training to make it functional for that person, rather than just building muscle mass or for aesthetic purpose, you want to make that exercise functional, because in life, this is what we need to be, functional as we age, right? So we must include pull, push, squat and hinge, lunge, and rotation in our exercise program if we can. And of course, if choose close chain exercise if we can. And of course, we want to also recommend them to do some aerobic exercise, simply because of for cardiovascular purposes, and also if we can, impact-based type of exercise. So for example, from a Monday to Sunday, you can recommend your client to do strength training on Monday, and while their muscles rest, you can ask them to do moderate jogging for 15 minutes, and then rest entirely on Wednesday. Thursday, maybe a moderate hiking exercise. Friday, strength training. Saturday, rest. And Sunday, moderate stair climbing. Now, this is just an example of how you can actually program an exercise program for someone with osteoporosis. Right? Some people, again, are more conditioned and some are less conditioned. So it's important that you adapt to their ability and not give them a cookie cutter approach. Okay? So, the next thing, we have program, we need to have a goal. So what you want to do is that we need to have SMART goals. So SMART is specific, measurable, achievable, relevant, and time-bound. All right, so number one is that you want to be very specific to tell them what they want to achieve so that they are more motivated to achieving them. For example, some of the goals that I set for some of my clients is to build 2 kg of muscle mass, right? So very specific. We can't say that we want to build 500 grams of bone density. There's no way of measuring that. But what we can do and measure using bio independence, or what BIA, where you stand on that machine and the electric current runs around your body and it measures your body composition. So that is accessible. So you can tell your clients, okay, let's build 2 kilos of muscle mass and try to consume at least 1.5 gram of protein of body weight a day and 1,000 calcium and vitamin D. So that's very specific. Your client is able to do that, right? And then you make it measurable. So I mentioned earlier using BIA to measure body composition every month. And interesting enough, I was working with a client. She has a very early onset osteoporosis. So basically, she has osteoporosis at the age of 40 plus. So that's pretty rare. And also, sometimes it's hard to keep measuring her so often when it comes to DEXA, because DEXA usually do it about every 9 to 12 months because of the radiation and the accessibility to that machine. So there's one interesting way that I work with a doctor to measure our progress through a blood test, and that is called a beta cross-lab test. So what it does, it monitors the bone turnover markers, and it is useful to tell if our bone remodeling process is unbalanced. So there's this level called a beta C terminal telepeptide, something like that. It basically tells us the increased level of bone resorption. And if you are osteoporosis, your levels are usually very high. It shows in your blood work, it's very high. So what we want to do is that one way is that to reduce that levels to reach within its normal range. So interesting enough, through natural intervention, which is through diet and exercise, we actually saw that levels reached towards the normal zone. And when she did a DEXA scan about 6 months later after the intervention program, we did see improvement in her DEXA score. So that's one interesting way to measure bone density indirectly using blood work. And that blood work can be done every 3 to 6 months. So that's an interesting way to actually measure our progress when it comes to bone health. Right. Next thing, of course, achievable. You want to gain 1 kg of muscle mass within 4 months. You cannot, if you say, I want to gain 2 kg of muscle mass within 3 months, and that person says it's impossible, definitely your goal is not right. Okay. So make it achievable. And of course, relevance. So if the person comes with you to overcome their bone density, you want to pick a program that's specific towards that instead of sports performance. Sometimes when as a personal trainer, we are always conditioned to have performance-based, lose weight, run faster, live faster, but that may not be relevant to that person. All the person wants is to build their bone density. So instead, we want to look at fall prevention, choosing the right exercises for their bone health and their muscle health, and also make it functional so that they don't hurt themselves in their daily physical activity. And last or not least, the time bound. It can be a 3-month program, and then we follow up again, or maybe a DEXA follow up in 12 months. So your SMART goal has to include all these 5 attributes to make it effective for your client. Okay, so the next thing you want to do is that what are the contraindications or precautionary measures we want to take note of for someone with osteoporosis? Okay, number 1, I would like to highlight this. Technique and posture is very, very important, because if you use the wrong technique, you end up injuring yourself, and that will probably cause them to drop out from the program, or at worst, a fracture of bone, which is something we want to avoid altogether. So make sure that technique is right, your form is good, and your posture is optimal before we start any aggressive weight training program. And number 2, progression methods. We don't want them to lift too fast, too hard, too soon. We want to build up their progression. For example, from less osteogenic activities such as walking, build their confidence, build their stamina, and introduce a more osteogenic physical activity such as running or hiking, and by lifting lighter weights and progressing to heavier weights. And then you want to be aware of other health conditions, because people who comes to you with osteoporosis, they are probably above 50 years old, and likely they have other pre-existing health conditions, maybe diabetes, hypertension. So you want to take note of other health conditions that may come together with osteoporosis. Why? For example, hypertensive person, one of the contraindicated exercise or movement that you may want to avoid, especially if their blood pressure is not under control, is putting their head below their heart. That would elevate their blood pressure and cause problem. So by knowing that this person has not a very well controlled hypertension, you might want to include exercises which involves them standing upright more than putting their head down towards the ground. Okay, so you need to be aware of other health conditions, and avoid high contact sports like football, rugby, American football. Those are the stuff that you want them to avoid, because the benefits, the risk just outweighs the benefit. Yes, football is good because there's a lot of sprinting, changing of direction, this and that, but that benefit can actually be replicated in a gym setting, and there is no risk of any accidental high contact. So if there's a football, there's a tackle, you're definitely going to fall or probably break your hip or something. So the benefit definitely does not outweigh the risk, right? So you want to avoid high contact sports. And also look out for symptoms. So let's say you introduce deadlift, for example, which actually targets the lumbar spine. And if you've done this, like let's say you did, okay, I did deadlift today, and then the next day your client comes back saying, I had this very sharp piercing pain in my lower back, and I'm starting to experience some slight numbness at my glutes area. So you want to be careful, because we don't want to injure them. So whenever we do something, take it slow, and then you observe and monitor. If there's no symptom, everything's good, you progress slowly, all right? So look out for symptoms. Don't be too overzealous. And also when people with who's above 50, not only do they have osteopenia, osteoporosis, but very likely they also have osteoarthritis. These two are not the same, right? Osteopenia is basically brittle bone. Osteoarthritis is basically the degeneration of the bone cartilage. It's not the same, right? So osteoarthritis tend to be at the joint, and the most common place for osteoarthritis is your hip and your knee. So sometimes there's this rubbing, bone-to-bone rubbing. So what happens is that squat exercise or lunges exercise may actually be very uncomfortable or painful for them, right? So you may not want to go straight into that. You might want to work around it, improve their muscles surrounding the knee joint, and maybe later introduce them squat once they're able to do. So you need to be careful of all this this attributes or factors that comes quite common with people with osteopenia. Okay, so in conclusion, right, maybe your clients will come, most of them will come and seek your professional guidance to address their problem, but we as a healthcare professional should partner with your client. If you don't give them instructions, likely they will not follow through, because I'm just telling you, do this, do that, and they just do it, and they say, why is it not working? Because you told me that. But if we partner with our client, some clients say, I have this trouble doing this. Okay, why don't we do that? There's a brainstorming session. You propose something, your client agrees to it, saying, yes, it's relevant. I agree to your proposal. Let's work towards this goal together. Is likely to have a higher success rate. All right, so partner with your client. Don't just give instructions to your client. And it's important that we have a holistic approach to combating osteoporosis, because it's just not just strength training. It's not just eating high calcium vitamin D. It also involves other factors like hormones and other diseases that can affect our bones, right? So we need to view things holistically rather than just one-on-one. And of course, as a healthcare professional, being a massage therapist or whatsoever, or a physiotherapist, we need to continuously learn and self-improve, because science and research keep changing. It updates every couple of years. So we need to continuously learn and improve ourselves so that we're able to give better results to our clients. And of course, if you are a massage therapist, for example, and if your client has osteoporosis and you're not very good with exercise prescription, you should collaborate with other healthcare professionals so that you are able to work together as a team and help your client to achieve their goals better. All right. So I have this osteoporosis course on the website, which is, I think Danny said that is having a 50% discount right now. That course would actually include some exercises that you can do. And also, I did not mention about specific exercises. I just shared with you concepts and ideas about fighting and combating osteoporosis. But the course that I'm offering online actually dwells into the exercises and how to do them correctly. Okay, so if there's any questions, I would probably open the floor right now. Danny?
Wynn, that was fantastic. So thank you very, very much. And I think you answered by presenting. You answered so many of the questions that I had, which is always a good sign of a presentation. We did have a question that came in, so I'll actually, start with that. But first, it's important for me, just to I want to say, osteoporosis. When I think of it, I'm taken back a few years ago when I met the head of sports science for NASA astronauts, who was explaining to me how there's a heavy emphasis on strength training and resistance training for astronauts when they're in space, because there's an extreme degeneration of the bones when you are in space. So every time I think about osteoporosis, I'm taken to space and I'm taken to astronauts. But I want to ask you, you mentioned like the ages of 50 and above. And do you see cases of osteoporosis for, younger individuals in their 30s, 20s? And if so, like in what situations, do we know what's causing that? What lifestyle, besides going to space, what lifestyle habits maybe cause that type of thing?
So it is rare to come across someone having osteoporosis below the age of 40. But I mentioned earlier, there was one where I have this female client who's about 44, 45, and she has osteoporosis. So it's very hard to say. So the doctors were a bit perplexed. Why? Because her family history did not show any osteoporosis. Her parents were okay, her grandmother was okay. Only she had osteoporosis. But she was on the frail side, so she was underweight. She was way underweight, and then sometimes she has difficulty getting food into her body. She's too busy. She doesn't eat enough. And then she was, the second thing, sedentary. So we probably, not say jump to conclusion, but probably think that the likely cause of her having osteoporosis was probably being underweight, one, being sedentary, number two, and then not eating enough foods high in calcium and vitamin D and protein. So probably that's the case. There are people who are 20s and 30s, but I've not come across any yet. But if that's the case, likely so either that person may have a condition, health condition. So for example, some people suffer from certain chronic diseases, which requires them to take steroids in the long run. So that can actually affect your bone health severely. And of course, genetics does come to play.
It's amazing how, we always, when we grow up, I was an athlete. So when you grow up as an athlete, you're working in the gym, but you're only really thinking about, right, muscle and power, but you're not really thinking about, bone health. Do we see, like, do you see individuals, let's say, who get to their 50s, 60s, who maybe started, doing all these physical activities at a young age at an advantage when they come to, those later ages? Is there a long-term advantage for facing something like osteoporosis when you are in your teenage years, 20s, 30s, and focusing on all these exercises instead of, approaching it when you start feeling symptoms?
Yeah, so I think that it's always best to start early. That's the principle I always follow. You don't have to wait for something to happen before we start. So I think there's some studies who saw athletes, and then they measured, there's two, sarcopenia, which is muscle mass loss, and osteoporosis, which is bone loss. And they noticed those active individuals, even in their 60s, has less of those compared to those who are sedentary in their 40s. So actually those who've been very active since their 20s, in their 50s right now, actually have better muscle mass and bone health compared to those who are sedentary in their 40s. So yes, definitely starting early is always best. And not only should we start early, we should be consistent throughout our life. So even though we're so active in the age of 20 and 30, and then we become sedentary, of course, things will start to fall apart.
It's you being also a licensed massage therapist and a believer in manual therapy, do you see also, like, as adding that type, hands-on therapies like massage into the mix of different things to combat osteoporosis, including nutrition, including exercise, including lifestyle habits? Would you throw that in there as well? Have you seen success with that?
Yeah, definitely. Because when I think of manual therapy, I have to emphasize this. It does not contribute to bone health. Massage therapy does not help with bone health, because we need to understand Wolff's law, right? We need stress on the structure in order for the body to adapt and build. So massage therapy can actually help when someone is having pains and aches, maybe from poor posture or from mild injury from exercise, for example. Like I mentioned earlier, osteoarthritis at the knee. There are studies showing that massage therapy actually help reduce pain for knee osteoarthritis. So manual therapy does come to play in that situation, so that that person can feel better, so that they're able to continue with their physical activity. So yes, that's why it's a collaboration between different healthcare professionals. It's very important for your clients. So for example, if your client has painful knees, and then if you don't address that problem, that person is probably going to quit. So it's definitely not going to be very helpful for that individual. Whereas if you refer to, or if you perform manual therapy to help relieve the pain so that the person is able to continue the physical activity, then that's how manual therapy does come to play. And it's very, very relevant in that area.
Excellent. So I want to throw a few questions at you here, from the audience. So number one is, it says, from Marilyn, are you using a trabecular bone score to assess bone health as well as the other metrics that you mentioned?
Okay, I'm not too familiar with what that is. I may need to look up, because what I usually use is the DEXA scan using a T-score, because most of our doctors and our healthcare professionals in Malaysia uses DEXA as a way of measuring and identifying or detecting osteoporosis. So I'm afraid I need to find out more to answer that question.
Good. So yeah, so Marilyn will send you to do some research on that one, and hopefully it's something we can answer in the next time we do this. A question from Yusuf here is, does having fizzy drinks affect bone density and contribute to osteoporosis? I don't know if Yusuf, if he means specifically just carbonated drinks, or sugary drinks, soda drinks as well. Yeah.
Okay, if it comes to fizzy drink, as in like just gas carbonated gas in plain water. I don't think it affects bone health at all. It doesn't play any role. I've read studies that did that, and they said nothing. It doesn't affect bone health. Whereas soda and
but is it something? Sorry to cut you. But is it something that's like thrown out there as maybe like a myth or a question?
Yeah, it's more like a myth. I've heard about it. That's why I did read up about it, and it's a myth. Yeah. Whereas sugar-laden soda, like Coke, and
without attaching any brands to it.
Okay.
No, I'm joking.
But everybody knows that one.
Yeah,
right?
yeah.
So sugar-laden beverages, soda, yes, that can affect not exactly directly bone health, but it can cause obesity, and then that can attribute to other issues like being sedentary. So indirectly,
also what you were talking about, the whole nutrition thing, right? You want
yes. So holistically, so look things at everything holistically.
Yeah, excellent. And then there was a question to specifically expand on the basic to moderate balance training moves. Because you touched on that briefly, I think, earlier.
Correct. So what was the question about that?
No, so maybe just to expand on maybe some examples that Karen here is looking for. Maybe some examples of basic to moderate balance training moves, which I know, yes, in the course, we describe all these different things. Maybe you can just give a little flavor.
Okay, sure. So basically, what we do is that the most basic stuff we want to start off with is, number one, before you do any of these tests, you have to make sure that the surrounding ground is clear from any obstacles in case they fall. And always be near your client to catch them in case they fall, right? So what I would do, for example, if I just casually observe, okay, this person looks, the way he or she walk is a bit not stable, that he tends to sway left and right. So no, there's a very high risk of that person falling. So I'll probably start the most basic way, which is standing on two foot together, just like that. Okay, so I put it as close as together, and I get them to cross their arms so that they don't use their arms to counterbalance themselves. Cross them, and then I stand like that, foot side by side, and I probably start the watch and time them. And if I start to see them swaying left and right, and they start to lose their balance, so I know that they are very high risk of falling. So I'll probably get them to separate their leg further, hug themselves. So that's one way of progression. But rarely do people fall standing like that. Because if that's the case, maybe there's other issues like vestibular issue, which is probably something to do with their brain or their ears. So that I have to refer out to someone else rather than to continue my program. So moving forward like this, right? They have no issue. I'll probably ask them to stand like that, staggered, cross your arms, hug their body, no problem. Staggered like this, right? Cross your arms. This is where most people will start to sway and start to fall. And also, I'll probably get it. Okay, let's make it easier. Open your arms, use your hands to help you balance. Get them to at least 30 seconds, 1 minute. Then once they're good, okay, stand on one foot, hold on to something just in case, stand by next to them in case they fall down, give them confidence in doing the exercise. Because one of the things why people fall is not because they can't, but their lack of confidence. So sometimes just standing physically there by them, ready to catch them and say, I'm here for you. If there's anything, I'm here to catch you. Most of them were able to stand longer compared to them standing alone. They feel fearful and immediately say, no, I'm not going to do this. So that gives you false positives when it comes to identifying fall risk. So I hope that answered your questions.
Yeah, it was great explanation. And then just to finish off here, actually something that I was going to ask you about, because I took notes of it, was the idea of vibration. Marilyn is asking, are you using or recommending the use of vibrational plates for exercises for bone health? And I was going to ask you because you mentioned about the cycling going downhill and it being positive effect because of the vibration involved.
Yes. So there are studies saying that power plate, for example, does help improve bone density. In fact, I have one client who suffers from chronic pain because of the spine, their cervical spine and lumbar spine is impinging the nerve. So she's on constant pain and she's contraindicated to lift anything heavy, and she's becoming osteoporosis. So these are type of complex cases that you may come across. So what I actually did was recommend her to go on a power plate, where all she needs to do is to stand on the power plate, turn on the vibration, maybe just stand there or do a half squat, That could help. There are some studies saying that power plate can be helpful for bone health. But I haven't measured it myself, because I don't really have a power plate in my studio to perform on my clients. Awesome. But there are studies.
Yeah, but very interesting also about what you said about the cycling. Very interesting. So fantastic. So look, I don't know, there's a lot going on here in the chat on the right-hand side of the screen. So just so you know, a lot of people, have paid a lot of remarks of thank you and appreciation to your excellent presentation, and for spending time here with us. So also from me, thank you very, very much. It was really fantastic.